until the killers are found. Let's turn our attention now to COVID-19 pandemic, and the national government is tonight warning that you must not lower your guard as the current third wave is deadlier if not checked. Now, the daily numbers also continue on the upward trajectory, with the number of new infections over the last 24 hours standing at 1,279, representing a worrying positivity rate of 17%. Our health and science reporter Saada Hassan paints a grim picture of this state of affairs.
Kenyans seem to have lowered their guard against the coronavirus, as evidenced by these trends in infections and deaths. The positivity rate has been rising, way above the recommendation of the World Health Organization of maintaining a positivity rate of below 5%. Kenya has had an average of 8%. The number of people admitted in hospitals has also been on an upward trajectory, with an average of 63 people every day being admitted in ICU. The total admissions are currently 754. Those on ventilatory support are an average of 22 a day, which represents about 38% of those admitted in the ICU. Today, Kenya has recorded a total of 1,937 people who have died due to the virus after 12 more people succumbed in the last 24 hours. Different coronavirus variants causing disease have been detected.
We also had one, of course, that was reported from a sample in Nairobi that had not even no history of travel, but was reported as the UK variant. You may also be aware of some surveillance which is happening in our lab in Kisumu, where again so far we have sampled about 62 samples from travelers who are traveling from the UK, and out of this we got 44 sequences of the UK variant.
Addressing the media today, Health CS Mutahi Kagwe has urged all counties to reopen their isolation units in preparation of any surge of COVID cases.
Counties open all isolation facilities in preparedness for immediate use.
According to the chairman of the Vaccine Deployment and Vaccination Task Force, Dr. Willis Ahwale, about 20,000 Kenyans have received the COVID-19 jab in 2 weeks' time.
The health workers, and I was in one of the trainings, and I know some of you came to even cover it, they were taken through monitoring severe events.
Community transmission is now at its peak, with the ministry emphasizing the need to remain vigilant. Saada Hassan, KTN News.
Well, the government is putting a keen eye on the state of affairs. Tumbere in Embu, where a family this afternoon laid to rest a mother and her daughter who passed on due to COVID-19 related complications. Now, the Njuki family is just one in the country that have lost more than one loved one due to COVID-19. As the country experiences the third wave of this virus, our senior reporter Rita Tinina with the harsh reality of the third wave and why you should not be sitting easy. I'm told Rita Tinina is working on that story. We'll definitely have it for you in a little bit. Now, also a three-judge bench at the High Court has today dismissed a petition challenging the legality of the anti-FGM law in the country. Now, the petition had been filed by medical practitioner Dr. Tatu Kamau, who wanted, among other things, the anti-FGM board disbanded and medicalization of the cut to allow females above the age of 18 to voluntarily undergo the cut. According to the bench, the petition lacked merit, as George Maringa now reports.
The recent decision of Simon Baldwin.
The day was finally here. Nearly 5 years since the petition was first filed at the High Court, all eyes were on the three-judge bench: Lady Justice Lydia Achode, Justice Kanye Kimondo, and Lady Justice Margaret Muigai to decide on an application by one Dr. Tatu Kamau on the legalization of FGM. It was a ruling that was much awaited by Kenyans.
It's a very minor procedure. It's a minor surgical procedure. It does not need a full theater. You don't need to book a theater. It does not need general anesthesia. So if it is medicalized, it is made very safe.
In the petition number 8 of 2017, the petitioner, Dr. Tatu Kamau, was seeking, among other things, the disbandment of the anti-FGM board. On that prayer, the bench ruled